Good morning, Mary. How are you doing today?
Good morning. I'm good. How are you?
I'm doing well. How did your homework go last night? Did you have any questions on any of that?
I don't think so. Maybe just about what we're going to do later today for the patient, but it was really interesting to kind of learn more about polycystic kidney disease. I didn't know anything about it before. I had to research it yesterday.
Mm-hmm. Yeah, we don't see it very often here on the med-surg floor, so I thought that was a really good case to pair
Yeah.
you with. So you're going to be with Mr. Dan Smith. He's 57 years old.
Mm-hmm.
And I just want to give you the rundown of what his vital signs were from this morning.
Okay.
He had a temperature of 98.5, which is good, so it looks like he doesn't have any active infections. A respiratory rate of 14, pulse of 88, a blood pressure of 180/79, which is something we'll have to manage, and then a pulse ox of 98%. So
Okay.
that's kind of where he's sitting right now. But I looked over your concept map and it looked really good. I just wanted to kind of just see where you're at with your understanding on polycystic kidney disease. Could you just talk me through what you understand about it?
Yeah. So I found out that it's a progressive kidney disease that's genetic, and it's actually one of the most common genetic disorders in the world. But basically what happens is there's just kind of a lot of repeated cell division in the renal tubule of the kidneys, which causes a formation of these cysts, which are like really, they basically kind of look like blisters on the kidney. They're like these really big cysts that have really like thin walls, and they're filled with fluid. And then as the disease kind of goes on, the kidneys just get bigger and bigger because of these cysts that keep forming. And then the formation of these cysts kind of compress the renal tissue, and they don't allow adequate blood flow and nutrient supplies to the kidneys. So there's a lot of harmful effects because of it. Not to mention it's like painful for the patient. And then I'll kind of be curious to see what signs and symptoms Mr. Smith has that kind of align with PKD, because what I found was that people with PKD have hypertension, which you did mention in the vital signs, hematuria, and then like pain in their back or abdomen or kind of in their flank area, and then like headaches, UTIs, urinary calculi, and then you can actually, I didn't realize you can actually like palpate the enlarged kidneys on both sides. So that was, that's definitely interesting. I wonder what I'll be able to see in the physical assessment later today.
Yeah, for sure. And you will be able to palpate that on him. He's got a really good, he's going to have a really good head to toe for you, because that's something that he presented with a couple days ago. He was having that hematuria, and that's really what he presented with, because he was in that and the pain. So we admitted him about 2 days ago, and we've been managing that. But so what he's got on the schedule for today is a needle aspiration, and that's going to drain the cysts, and that's also going to help alleviate some of the pain.
Okay.
Other treatments that we're going to be doing are going to include, so he doesn't currently have a UTI, but he has had a history of that. So we'll kind of give him some advice on how to manage chronic UTIs.
Okay.
We'll be giving him some pain medication. It hasn't been so severe that he needs morphine, so another acceptable pain medication is acetaminophen.
Okay. Are NSAIDs okay instead, or what is that?
No, we want to avoid NSAIDs because they're really hard on the kidneys, and especially with him, it could cause some nephrotoxicities.
Okay, good to know, just in case he asks.
Yeah, no, that was a great question. And the other thing, as you noticed, he's got hypertension, so we have an ACE inhibitor we're going to give him too. He's not so severe that he needs hemodialysis or peritoneal dialysis, which are some other treatments that we do sometimes see with PKD patients.
Okay.
And then all of the above that I mentioned, those are symptomatic management, whereas the only curative measure is through a renal transplant.
Okay. That makes sense. Do you know if he So he officially got diagnosed with PKD. Do you know how they, like, what kind of diagnostics did they use for that? I'm just curious.
Yeah, so they ran a urinalysis, and that they did see blood in his urine and also some bacteria
Okay.
with some elevated white blood cells. So, which it makes sense with having a history of chronic UTIs,
Yeah.
and that's pretty common with PKD patients in their urinalysis.
Mm-hmm.
And then other diagnostics that the doctor ran on him included an abdominal ultrasound. They took him in for an MRI. And then you can also do IV pyelogram and CAT scans, but he
Oh,
hasn't needed any of those yet.
okay. That makes sense. So they
And
just were
that,
able to, like,
mhm,
actually visualize the cystic kidneys that way.
yep, that's exactly right. So
Cool.
it gives us a good look at all those little ridges that he's got in his kidneys.
Yeah.
So, and I'll pull up those pictures for you later today because it's a really cool thing to see.
Okay.
And then other than that, so nursing interventions we're going to do, like I mentioned, we're going to manage his hypertension.
Mm-hmm.
And we're also going to include that in his patient discharge teaching, because that's going to be important that he follows up and continually monitors his own blood pressure at home.
Okay.
And then also pain management, the doctor's going to send him home with some acetaminophen. I believe it's going to be about 800 milligrams. That's why he's getting that prescription. And then if he needs to, he can get some over-the-counter acetaminophen.
Okay.
And then we've also been using dry heat on his abdomen and flank to help, and that reduces discomfort. So that's another pain management strategy. And then infection prevention, we're mostly just making sure that he doesn't get another UTI because that can cause some more complications.
Mm-hmm.
So we've been doing daily urinalysis on him to just monitor and see where he's at from his baseline when he was admitted.
Okay.
And he hasn't shown any signs of constipation yet, but that can be another complication with PKD patients.
Okay.
So that's something else we'll want to include in our education with him.
Okay, that sounds good.
And so I figured it'd be great, since you're a senior, just to let you take charge of the discharge teaching if you feel comfortable with that. Can you just run me through what you would like to teach him?
Yeah, so I think just because he has the potential to have constipation, and then also he already is hypertensive, I think I would definitely talk to him about kind of maintaining an adequate diet that is going to be able to kind of control his hypertension, so hopefully less sodium, and then also making sure he's getting adequate fluids and fiber just to make sure he doesn't have any constipation. I didn't see if he smokes, but I'll take another look at his chart and then I'll try to talk to him about smoking cessation if that's an issue. I'm also planning on assessing kind of his lifestyle and behaviors, like if he's exercising, even walking every day or something like that. That is definitely going to be something that I will promote and encourage him to keep doing. And then, like you said earlier, I'm going to also just reinforce that he monitors his blood pressure every day and then checks his weight every day to make sure that nothing too drastic is happening. And then I'll also educate him on just signs and symptoms of just any sort of infection like a UTI. I'm sure he's well aware of the signs of a UTI just because he's had so many, but I'll just kind of assess his knowledge on that and make sure that he knows kind of what to do if he starts feeling the signs and symptoms of a UTI. And then I'll see his kind of, if he wants to be referred to, kind of how he seems to be coping with this diagnosis. I'm going to kind of talk to him about that and just see if maybe he would want, someone to come and help him, maybe a nutritionist to come and help him with his dietary needs if he's kind of unfamiliar with what he needs to do, and then maybe if there's support groups that he would be interested in joining. I would definitely kind of give him some information about that too, just so he can kind of best control his new diagnosis. Bless you. Does that sound good?
Yeah, great. That all sounds really good.
Okay.
I also have a pamphlet that I sent you through that PowerPoint slide.
Okay.
I think that's also another good thing we could give them that'll help reinforce that dietary
Yeah,
education.
definitely.
So that all sounds really good. I feel confident in you giving that information to him. Did you have any other questions before we go meet him?
I don't think so. This has been really helpful.
Good, I'm glad. You're doing really great. So I think today's going to be a really great day for you. So,
All right. Thank
all
you.
right. Thank you, Mary.